Good afternoon, everyone, and thanks for joining me today. I'm Jennie Montgomery. Welcome to another half hour of information to help you make the most of your time, to make informed decisions, and to keep up with goings-on around Greater Augusta. Jennifer Pennington is here from the Judge C. Hickey Center for Alzheimer's Care. She'll tell us about an upcoming concert called Music for Memories and how it will benefit the center. And are you in need of a purse? Not just any old handbag, but a purse for a purpose. The annual fashion fundraiser for the Jesse Norman School of the Arts is the place to find it. More about that a little bit later. But up first today, we are talking about important health warnings, especially for those of us who live here in the stroke belt. A breakthrough stroke treatment can save lives if it's available, and fortunately for us, it is right here at the Medical College of Georgia at Augusta University. In fact, the Dean of MCG, stroke specialist Dr. David Hess, says this is the biggest deal ever in stroke treatment. And that's why training like this stroke assessment class at Gold Cross headquarters in Augusta is so important. This class teaches first responders how to spot the signs of a stroke. A breakthrough stroke treatment can save lives, and it's often up to these professionals to get patients to the place where they can get that critical care. The thrombectomy is transforming stroke care, even preempting brain damage in patients. It's information like this that forces EMTs to be good investigators in the field, because several symptoms mimic a stroke, like low blood pressure or post-seizure.
We can do evaluations in the field, and we can find out exactly what location of the brain the stroke is happening in, and that's a lot more knowledge that we can have. Time is more of the essence with stroke patients. This is one of the things we can't do anything about till we get them to the hospital. So it's real imperative that we get them as fast and quick as we can.
And we have a couple of gentlemen here who know how important it is to get there as fast and as quickly as possible. I want to introduce to you Dr. Edward Mendoza and Dr. Scott Rahimi, and they're both here in two different capacities. Now, Dr. Mendoza here, you had a massive stroke. Right before you turned 71, a massive stroke. You are a neurologist.
Yes.
He goes to MCG, paralyzed and unable to speak. And then it's miraculous. He leaves a couple of days later. So, Dr. Mendoza, how did you know? I mean, being a neurologist, I'm sure you know all the signs and symptoms. What did it feel like when you began to realize that was happening to you?
Well, I had no signs and symptoms. My wife we were downstairs talking, and my wife said that I kind of turned around and slumped over. That's all that happened. I had no signs and symptoms, no premonition. It just happened.
And so, what did she do?
Well, she went right up and called 911. And the first responders were there. I don't know what time, but the recollection I have is them carrying me out, that's all. And then my next recollection I have is I woke up and saw somebody gowned, which I guess was the procedure doctor. And then the next thing I remember is 2 or 3 days later.
Oh my gosh.
Yeah.
Well, in those 2 or 3 days, a lot of stuff happened, and the one who can tell us about that is Dr. Scott Rahimi, who is a neurosurgeon and the director of endovascular services at the Medical College of Georgia. So what happens then when the patient arrives, unable to walk, unable to speak? That's when I guess you begin to see them?
Yes, we work with our neurologists, but time is very crucial, because every minute that passes, you lose about 1 million brain cells. So the quicker you can get to this problem, the better for the patient. The patient comes to our emergency room, gets transported to the room where we do these procedures.
The procedure that you're talking about is this thrombectomy?
Yes, the mechanical thrombectomy.
And it is a really big deal, and it can prevent someone from being paralyzed or diminished capacities physically and mentally, but not everybody has it. You're lucky that you have it.
Outside of Atlanta, Augusta is the only city in Georgia where you can get this kind of treatment. So it's Augusta and Atlanta, and it does make an impact, because if you have a devastating stroke involving half the brain, there's a chance of death or severe disability.
Dr. Mendoza was so lucky that his wife was home at the time.
The EMTs came, and one of them, she said, what should I do? One of them said, go to MCG.
Take a look now at what they pulled out of Dr. Mendoza's brain, this clot.
This is a standard thrombus or clot. The stent retriever acts like a fishnet where you capture the blood clot and you pull it, preventing the blockage of that blood vessels and restoring blood flow to that portion of the brain.
We have a picture that we want to show you right there. It's an angiogram image of the clot in the brain.
This is showing the blood vessels going into the brain. The blue arrow on the image is where the area of blockage is. As you can see, there's no darkening of the blood vessel past the blue arrow. And then the post-angiogram is when the clot was retrieved using the stent retriever, and then you can see all those blood vessels lighting
They're just
up.
expanding, absolutely.
This is a lateral arteriogram that the blue arrow is highlighting the area of the brain that should be darker. There is no blood perfusing.
Getting there. Yeah.
And on the post-angiogram, you can see that there are many blood vessels go into that region. And without removing that clot, that entire area of the brain would have a massive stroke.
Does it just kind of like die? I mean, that part of the brain?
It would be dead brain,
yeah,
non-functioning brain.
You just must feel so lucky that things happened for you like they did.
Yes, it was.
And that you were able to leave the hospital in a couple of days.
Well, the recollection from my wife is that within a couple of hours after they did the removal, I was moving my right side, which I was not moving at all.
Wow.
Okay. Like they say, who the president, I'd just say, okay, okay.
Yeah.
Move your arm, okay, okay. But I wouldn't, no reception and no expressive. And within 12 hours, that started to come back. And within about 18 hours, I was completely able to talk and function and everything.
I have worked with two people who did not have good outcomes like that with stroke. And if only they had been able to be treated quickly, how things could have been different. Thank you so much for sharing your story with us. Still ahead, actual footage from inside the OR as local neurologists perform a thrombectomy. You don't want to miss it. We'll be right back.
Xfinity, the future of awesome.
Welcome back, everyone. And if you are just joining us, we're talking about an exciting and life-changing stroke treatment. What some say is the biggest deal ever in stroke treatment, called a thrombectomy. Patients go from a high likelihood of dramatic physical and mental deficits, even death, to mostly walking out of MCG on their own 2 feet. Dr. Jeffrey Switzer is the director of the Comprehensive Stroke Center at MCG, and Dr. Scott Rahimi, who was with us in the last segment, is a neurosurgeon and director of endovascular services at the Medical College of Georgia. So we talked last segment about Dr. Mendoza, and we had the pictures of what happened, you know, before and after the treatment, the thrombectomy. Now we have video that you all have graciously shared with us of the actual procedure. So I would like for us just to play it now and sort of explain what's happening.
Okay. This is our angiography suite at the Medical College of Georgia. This is my partner, Dr. Sapiti, who's doing this procedure. There are 2 of us in Augusta that do this procedure, and Medical College of Georgia is the only place you can get this done. He's a neurologist that is trained specifically to do this, an intervention neurologist, and neurosurgeons also do this procedure. You can see
They're getting it with the net-like thing there, is that right?
Yes, you see a variety of catheters or tubes that go up the blood vessels, and that's a wire going into the clot where you deposit that net-like stent and pull the clot out. And all this happens through the groin.
Really? That's where you're going, and you push it up.
Yes.
From there.
All these wires and catheters all go through the femoral artery, through the groin, all the way up to the brain.
Is it a machine that he's in?
It's a X-ray machine, and it has.
Okay, so that lets you see it on the screen, and that's how you see what you're doing?
That's correct. And the dye gets picked up by the X-ray machine. That's why the blood vessels look dark.
Right, and that just helps you see everything you're doing. Right. Dr. Switzer, you would be someone who would initially like meet patients, stroke patients when they come in. Is that right?
Yeah, that's right, Jenny. So, you know, I think the focus here for your listeners is about how much stroke has dramatically changed over the last couple of years in our ability to treat patients. So up until the last couple of years, the only treatment that we had to offer was giving this medication, TPA, through an IV in the first few hours if they were recognized as having a stroke. So now with these procedures, the TPA unfortunately didn't always work, or there were some patients who aren't candidates, who weren't good candidates to get it. And what this does is allow us to help patients with, you could say, the most severe strokes, the largest clots where TPA often wouldn't work. We now have a strategy where Dr. Rahimi or Dr. Sapiti can mechanically go after it, literally pull that clot out. You know, in the net and reestablish blood flow and prevent permanent damage in the brain. And then to see it yourself, though, at first you almost can't believe it.
Yeah.
But then to see patients like Dr. Mendoza and others who you knew just a year ago, we couldn't have helped, may not have survived, or certainly would have their life permanently changed.
Yeah.
And then they leave the hospital 2 days later as if nothing happened. I mean, as a physician, somebody's taking it, it's amazing.
What is the little thing that we're supposed to remember? Is it FAST, the thing about stroke, the symptoms?
Yeah, so FAST is an acronym: face, arm, speech, and then the T is for time, emphasizing call 911, this is important. So it's, if you're concerned someone's having a stroke, you ask them to smile, as you look for asymmetry of the face. One side is not. You ask them to hold up their arms. You see one arm that drifts down. It's usually one side of the body, not weak all over. One side drifts down. And then speech. If their speech is slurred or they can't get their words out, and the T is for time, and they call 911. So that's the first step. The next step is the paramedics. Richmond County, Columbia County, that's Gold Cross. They confirm that they're seeing a stroke. But they also can look and say, this isn't just an ordinary stroke. This is a severe stroke. This is one where this might be a case where we need Dr. Rahimi to go in there. And there are very few hospitals that offer this strategy of doing these thrombectomies. So unfortunately, if you go to another hospital, maybe we recognize, maybe it won't, but then you got to get transferred to another hospital.
And then that's the whole time. And you must be like on speed dial for so many people there at the hospital. Gotta get this guy.
It's an exciting time. I mean, it's revolutionized medicine. In the 70s, we had surgery for carotid artery. In the 80s, the stent for the heart came out. In the 90s, the robotic surgery came out. And I think this time is for mechanical thrombectomy.
Gentlemen, thank you again for your time today.
Thanks for having us.
Thanks, Jim.
We'll be right back.